Good afternoon, everyone. I'm the Commissioner for the Department of Public Health, and my name is Renée Coleman Mitchell. I'm here today to give you a couple of points and information regarding coronavirus, which is also deemed as COVID-19. First and foremost, the state of Connecticut at this time does not have any positive COVID-19 cases. We also have been approved as a state, our state lab has been approved as of Friday to do the testing for coronavirus, also COVID-19. As a result of that, this weekend we did 2 tests for persons under investigations, and we're happy to report that those individuals were negative. Again, at this time, I must caution all of you that, as you're probably aware, that this situation is extremely fluid and dynamic. It could change at any moment. As your commissioner, it's important for me to say a couple of things in terms of precautions. I want to say that basically the risk is low for U.S. citizens as well as Connecticut residents. With that said, it is important for you to wash your hands, for you to cover your mouth when you sneeze or cough. We are also asking that you no longer shake hands as a precaution, that you do an elbow bump. We also ask that you stop, if you can, to stop touching your eyes, your nose, and your mouth. And we ask that there be some social distancing and when you have experiences with individuals with symptoms. With that said, as your commissioner, I spent last week in Washington meeting with 7 congressional leaders from Connecticut. And it was important for me as the commissioner to communicate on behalf of Connecticut, the state health department, as well as our local health department people, the boots on the ground. The communication was very clear that we need to stay ahead of this as much as we can. We need to stay prepared. But in order to do that, we need resources, specifically funding. Our 7 congressional leaders, and one of them is here today, Congressional Leader Blumenthal, it was very important for all of them to hear what was being said. We need the funding to continue to be prepared. But I need to completely say this. Preparedness does not mean that we will stop the virus. It means that we will be prepared. I want to say that the Department of Public Health staff, who have been phenomenal, as of December with our first case, has been on board in communicating with the appropriate state agencies and local leaders, as well as other agencies, as we continue to now beef that up in preparation. So here today, I will tell you that I have the wonderful opportunity to introduce and welcome the United States Surgeon General Jerome Adams. I have to have a little say, though. We invited him in December to talk about overall public health issues. Who knew, with serendipity, that this would have been the perfect storm for him to arrive here in Connecticut and have the opportunity to share with us what is going on nationally with COVID-19. So without further ado, I'd like to introduce our U.S. Surgeon General, Jerome Adams.
Thank you. Well, it is great to be here in the state of Connecticut. It's great to be here with you, Governor, with you, Senator, and with your wonderful state health director. Again, we came here originally under different circumstances. I just was at Yukon this morning talking about the opioid epidemic and the 1,200 lives that were lost in Connecticut due to overdose last year. We're going to have a conversation with the governor over the next couple of days about maternal health and the fact that far too many moms, especially brown and black moms, are dying during the pregnancy time frame, and that for every life lost, we know that there are 70 additional moms who have preventable complications due to things like hypertension, due to opioids, due to other issues that affect maternal health. But the topic everyone wants to talk about today, and appropriately so, is the novel coronavirus. I want to start off that conversation by saying my heart goes out to the families of the individuals, the 2 individuals thus far who have lost their lives to coronavirus. We've seen an increase in cases in the United States over the weekend. I want folks to understand that we knew this was coming. We told folks that this was going to happen, and it is why we've been preaching preparedness from the very start. I want folks to know that we've been here before. The coronavirus is new, but we've dealt with SARS, we've dealt with MERS, We've dealt with with H1N1, and we literally all have a playbook that we are following to respond to the novel coronavirus. As the state director mentioned earlier, the risk to individuals from novel coronavirus right now is low. Why is that? Well, we know that risk is correlated directly with exposure. You can't get the coronavirus if someone around you does not have it. And due to the administration's aggressive containment strategies, we've done a good job of limiting coronavirus entry into the United States. And there's no doubt that has been successful. That said, containment works when you have a limited source. And our containment strategies were focused on limiting travel back and forth to the most affected regions in China. We now have over 40 countries around the world who have reported coronavirus cases, and we cannot hermetically seal the United States. So in addition to trying to contain virus entry into the United States from places that are most affected, we're encouraging communities to think about the steps that they can take to limit spread within communities and to mitigate the effects of the virus. Important for folks to know that we will see more cases, and in most cases there will be mild illnesses. Of the 14 original patients in the United States who were tested positive for coronavirus, all 14 of them have recovered or are recovering. If you are healthy, then in most cases you'll have a mild illness that will be like a bad cold or a flu. You'll feel bad for a few days, but you will recover. But just as with the flu, again, we've seen this, we've been there before, if you are someone who is unhealthy, who has cardiovascular disease or lung disease or other comorbidities, you will be at higher risk if you get the coronavirus. So we want those folks in particular to be thinking about travel, to be thinking about how they can protect themselves and take extra precautions, not just to protect themselves from coronavirus, but to protect themselves from flu. Important to note that 18,000 people in this country have died from the flu this year. 18,000. I believe the number is over 60 in the state of Connecticut now reported who have died from the flu. You don't have a single positive coronavirus case. Part of my job as Surgeon General is to help people keep things in perspective. And in terms of keeping things in perspective, we want folks to know that your risk as an individual remains low, but that doesn't mean that we as your health officials and state officials aren't doing everything possible to prepare for what we know will be increased cases of coronavirus. I want to finish by talking about the things that individuals and communities can and should be doing. On an individual level, we know that basic public health precautions like washing your hands for 15 to 20 seconds. And the senator and the governor and I literally just washed our hands before we came in this room and sang happy birthday as we were washing our hands, because that's what we tell people to do to ensure that you've properly washed your hands to protect yourself. Things like social distancing. And social distancing includes not going around people who are sick. It also includes making sure you do common sense things like not shaking hands in the midst of a particularly bad flu season. And that's why we elbow bump now instead of shaking hands. Other things that folks can do to protect themselves include getting a flu shot. How does that help? Well, again, you are at this point in time more likely to be exposed to the flu in Connecticut than you are the coronavirus. Number two, as we visited hospitals, and I was at UConn Health Systems earlier today, we know that hospitals are overflowing with flu patients. Every flu patient who takes up a bed in a hospital is a bed that's not available for a potential coronavirus case. So getting your flu shot protects you from the flu in a bad season. It also helps us prepare for coronavirus. We also want people to clean their surfaces, and we just talked about that also. It's really simple. Wash your hands, cover your cough, clean your surfaces, stay away. And we can turn it into a little TikTok dance if we need to, people. But we want folks to understand that there are steps that everyone can take to respond to the coronavirus outbreak and the flu outbreak that we have going on right now. On a community level, we want state and local officials to be thinking about and dusting off their preparedness plans, to be thinking about if this does worsen, then what should we do in terms of closures, in terms of telework, in terms of canceling large gatherings. We're not there yet. We're not there yet, but we want folks to be thinking about that so that we're prepared in the event that it does happen. Most of all, I want the people of Connecticut to know that you have the best team that you could ever imagine, not just here in the state of Connecticut, but on a national level. If you were to put together an all-star team of individuals to respond to coronavirus, you would pick Tony Fauci. You would pick Ann Schuchat. You would pick Dr. Robert Redfield. You would pick Alex Azar, who literally wrote the pandemic flu response booklet back when he was in HHS previously. So at a federal level and at a state level, we have an all-star team. We are prepared. We do expect that we'll see more cases of community spread, but folks should not panic. Caution is appropriate. Preparedness is appropriate. Panic is not. And many of you may have seen my tweet from this weekend where I advised folks to stop buying masks. While there are things that you can do to protect yourselves, there are things that actually can harm you and your community. And going out and hoarding masks is one of those things. We know that when individuals who are not healthcare workers and who haven't been advised by a healthcare worker to wear a mask wear them, they often wear them improperly, meaning that they provide very little protection against respiratory disease. One of the other things we know is that folks who aren't comfortable wearing a mask will often touch their face more frequently and adjust the mask, and can actually increase their risk of exposure to flu or coronavirus. So you may actually be harming yourself and putting yourself at increased risk by wearing a mask. And then finally, if we actually utilize masks inappropriately in the community and in the general public, they won't be available for healthcare workers who actually need them to respond. Again, caution, preparedness, but not panic. That's how we're going to successfully navigate this coronavirus situation, just as we successfully navigated H1N1 and MERS and SARS. We're here to make sure we continue to provide radical transparency to all of you. As the Secretary said yesterday, we're going to treat America like adults. We're going to give them the information on what we know and on what we don't know, and then we're going to trust Americans to make the appropriate decisions to protect our health. And the most appropriate thing to do is to prepare but not panic. Governor?
The Senator first.
Okay, thank you. First of all, thank you, Surgeon General, Vice Admiral, and Dr. Adams.
Thank you.
Thank you for being here today and for sharing some of that wisdom with us. And I want to thank, in particular, Commissioner Coleman Mitchell for her leadership. She and I have worked together on urging more people to get flu shots, and she's been a leader on opioids and a great many public health issues. And we're very fortunate in Connecticut to have her as the point person on this team. And the federal government could do very well to follow Connecticut's example and put professionals in charge of this effort at the federal level, not politicians, but professionals who respect science and will implement it and put science above politics. And thank you to the governor for his awareness and his leadership on this issue as well. I want to just take issue a little bit with the commissioner. We are not yet in a perfect storm, and the point of our efforts today is that we can avoid it. Preparedness stops panic. Prevention stops fear. Facts defeat fear. And so calling it what it is, rather than embellishing or trying to apply political rhetoric to it, is absolutely essential for the American people to have facts and that radical transparency that's so important. But as important as the words are the dollars. And that's part of the reason I'm here. I want to commit to the governor and to our commissioner and to all the people of Connecticut that we are going to fight for the money that is necessary to be effective and stop this disease from becoming the pandemic that is threatened. we have Connecticut's back. Not just me, but our entire delegation, united on this issue, that we are going to work and fight for a supplemental appropriation. This week and next, we hope to get it done in the next 10 days. Not the $2.5 billion that the administration has proposed, but multiples of it, at least $8.5 billion. And at least $2 billion of that money will go to reimburse local and state governments, exactly like Connecticut, that are proactive in the way that Connecticut is doing to help stop this virus from spreading. $2 billion to local and state reimbursement, another $3 billion to the Public Health Emergency Fund, which provides similar kinds of money, among others, to Medicaid expenditures that are necessary, $1 billion to develop a vaccine. We're still at least a year to 18 months away from a vaccine, but also money for global health efforts. And we need to be mindful that the major threat of spread comes from abroad. If we can stop it there, we can stop it from coming here. So this package, $8.5 billion, perhaps as high as $15 billion, we will push through Congress. And I say it with some optimism because it is bipartisan. And that's the point that I want to stress today. Congress is addressing this issue in a very bipartisan way. Take one example, my colleague who is the chairman of the Senate Appropriations Committee, Richard Shelby of Alabama, has shown that he is willing to act aggressively on this issue. And I've talked to him. We are working together to put together a coalition that will support vaccine development, state and local reimbursement, other kinds of public health steps that are necessary. Connecticut, we have your back, just as we do the backs of every other state. And we should, because this issue is a national threat. Let me just finish by going to where I began, our state public health network here in Connecticut. Over the last 3-4 days, I've been meeting with local health directors, state officials, hospital doctors, staff, volunteers, and I've been so impressed by their vigilance and vigor. And I think more of the testing, we're here at the state lab, they've recently been given authorization to do that testing, more of it can be done at the local level. And that's key to expanding the testing. If I were asked as a layman, I'm not a doc, I'm not a scientist, what is the priority step? Testing. You cannot solve what you don't know. And if you don't do the testing, you don't know where the virus is spreading. And it can be stopped if the spread is stopped. And I will just finish on this note. Longer term, the public health of our nation demands more resources to CDC and NIH, not the cuts that have been threatened by this administration. They demand more funds for a global health strategy. They demand more staff at the National Security Council, not the dismantling that we have seen over the last years. We need to invest in public health. We know these threatened epidemics occur, whether it's swine flu, H1N1, MERS, SARS. We are playing with fire if we fail to be prepared. And preparedness does defeat panic, but it also achieves health. And that's really what our goal has to be here. We need to invest in the CDC, the NIH, other public health measures, and in the public health networks of our states and localities. That's what makes us strong. That's what makes us strong as a nation, that we are prepared. We cannot shut down whole cities. We cannot tell people not to travel. We can be smart, strategic, swift in our response. And thanks to Connecticut, people here are a lot better off. Thank you.
Thank you, Senator. Let me just add that as your governor, my job is to hope for the best, but plan for the worst. And that's what we're doing. We're doing this at the federal, the state, and the local level. You heard Senator Blumenthal talk about the resources we need in terms of providing a lot of the backup we need going forward, in terms of perhaps some overtime for folks if this gets more aggressive. I really appreciate Dr. Adams being here. What this says in terms of, it's so important we have a unified message as we go out and talk to people who see pictures on TV and they get scared every day. And I think you give us a great deal of confidence about some of the little things we can do going forward. The development of the vaccine as we need it, that could be a year away. You're emphasizing getting the flu shots and how that could be a preventative. You know, Dr. Adams mentioned to me that if he had to make an estimate about what this might look like, and we don't know because it's changing so fast every day, he said probably like a really bad flu season. So take your flu shots. That means less likely you're going to be in the hospital emergency room, more room for us to be able to pay attention to the coronavirus. And Michelle and the Commissioner, I just want to say thank you. I know you've been down to Washington, D.C., working hand in glove with CDC. And we're, at the same time, we're working every day with our hospitals, making sure that they are ready. Working with our business community, just in case they have to think about what could happen next. Miguel Cardona, our Commissioner of Education, reaching out to each and every one of our schools and school districts, just in case. We saw what happened in Rhode Island. They've had an incident there where they temporarily had to close a school. I don't see any of that happen in Connecticut, but we are surrounded by states that have had one or two incidents, none yet in the state of Connecticut, but that's why we're ready. And I want to say I'm going on the phone with Vice President Pence in just a few minutes. And I appreciate the federal government. Get the experts up front, just like you, Dr. Adams. You talk about the all-star team. I put you right on that all-star team. Give us the information we need. Go to ct.gov. There's Dr. Google out there. He's pretty good, as you mentioned to me, but I would go to ct.gov. That's where you get the information. And as something like this is changing so fast, we'll give you the best information we can. But right now, I feel like the state of Connecticut is in pretty good shape. We're prepared for the worst, hoping for the best. We're here at the lab. I appreciate everything you've done, Doctor. You've showed us that we've done a couple of tests here already. We can get a test done in 3, 4, 5 hours, give people confidence that they don't have this virus. And we can prepare that even more. And as Dick said, if we need to, we'll be able to do the testing at the local hospital level as well. But right now, I think we're prepared, we're ready, and I just hope you take all the necessary precautions. Don't shake a politician's hand in the next couple of weeks. Probably a good thing to stay away. Thanks, everybody.
I just want to highlight something that the governor said, resources for people out there. ct.gov for state-level information, cdc.gov for national information, including advice on where to travel to and where not to travel to. That's how you can keep yourselves safe, by being informed, by preparing, as the senator said, by not panicking.
A few minutes for questions, we're not a lot of time.
Governor, right here in Connecticut, the UConn students, some of them are coming back from their overseas trips, and some of them have not been quarantined. What is your position on that? What should be done of the students who are coming back from UConn and other colleges?
Why don't you take that?
Well, it's interesting. Folks need to understand, first of all, the difference between isolation and quarantine. We isolate sick patients who've already been diagnosed. Quarantine, in this coronavirus situation, it's the first time in a long time we've invoked federal quarantine. And we did that for folks coming back from Hubei province, from China, because we knew that there was a high likelihood that they would be exposed to coronavirus due to the number of cases that have come out of there. And now over 80,000 cases out of China, still a high impact and a high risk area. As far as people coming back from other parts of the country and other parts of the world, we want to make sure we're looking at those highest risk areas. Right now we know Iran is a high risk area. We know that Korea is a high-risk area. We know that northern Italy is a high-risk area. But important for folks to know that we tend to leave quarantine decisions up to the state and local levels, and I encourage the states, as I've encouraged your health officials, to talk with CDC and to make sure they're making the best and most appropriate and most scientifically grounded decisions for folks. And it's going to look different for every state, every situation. Who are you? Where did you come from? And what part of the world did you come from? Is it at high risk for coronavirus? And ultimately, that's how we're going to come up with decisions that keep the most people safe.
All of you were mentioning the importance of these testing kits, but we have heard about some contaminated, faulty, unreliable testing kits. So what confidence can you give people here in Connecticut that these testing kits are going to work, and do we have enough of them?
Well, I'll take that just and say that that's why we're here at the state lab today. We all took a tour of the state lab here. I'm confident that Connecticut is ready to test. Are you all confident? I'm confident in what Connecticut is doing. I can tell you that I spent pretty much my entire day Saturday at the White House. The president, the vice president, and Secretary Azar have as their top priority making sure we're getting test kits out to people and that we have more places available to test. It is the number one item on our agenda as far as the task force meeting. And so I'm actually encouraged by the fact that more states are telling us they feel comfortable and they're ready to test. The important thing to know is as we test more, we are in fact likely to get more positives. The public should know we are going to see more cases, but that does not mean that it is a time to panic. Most of those cases are going to be mild, and when we find out about them, as the senator said, we can more easily protect our communities.
Let me just add, I think that was exactly the right answer. The Atlanta lab did have a contamination problem, and there was some question about the tests, in effect, being overly expansive, looking for other strains of viruses to be inclusive. The test that is in common use now seems to be reliable, but your question is a good one. We need to be vigilant. We need to test the tests, and there's always a possibility of developing a better test. But right now, Connecticut is using a reliable test. The samples brought here are analyzed reliably and accurately, and I think we can have a high degree of confidence. We never want to be overconfident or complacent, but there's no better place in the world to do testing than right here in the Connecticut lab.
Connecticut is using the CDC developed test that. That's correct. I mean,
Yes.
that's correct. Okay.
Can you comment on the importance of the flu vaccine? Is that because if people are not sick, their immune systems, and I mean, obviously we do not have a vaccine for coronavirus, and it sounds like we won't for some time. Is that the theory that, and we're kind of coming to the end of flu season, are we not?
A couple of really important things. Vaccines are one of the most effective public health tools of the last half century. And I am quite frankly concerned, and was concerned before we had this coronavirus situation, about the erosion of vaccine confidence and lowering of vaccination rates across our country. We know that states that have non-medical exemptions for vaccinations actually are at higher risk and tend to have more vaccine-preventable diseases occurring in their states, which not only has a health impact, but has an impact on the economy, the local economy. We almost lost our measles vaccination or measles eradication status as a country last year. So number one, vaccinations work. They are safe. Now, flu vaccinations. It is not too late to get your flu vaccine. We are in the midst of a really, really bad flu season. 18,000 people have died from the flu. Again, we don't know which direction this coronavirus situation is going to take, but I would be shocked. I would be absolutely shocked if we get anywhere near the hospitalizations or deaths from coronavirus that we've had from the flu in this country. The flu is a great risk to communities right now, and you can protect yourself with getting a flu vaccination. That does a couple of things. If you get the flu, you're going to be sick. And then if you have coronavirus superimposed on top of that, you will be more likely to have a negative outcome. If you get the flu, you will take up hospital resources. Those are hospital resources that are not available to respond to the coronavirus. There are many good reasons to get a flu shot. It's not too late. Go to ct.gov to find out where you can get a flu vaccination in this state.
Quick question about this laboratory and how it's going to be used. Will this be used to test for other states too? Will other states be sending samples here?
We have a regional network and a lot of communication. Our lab director works with the Northeast lab directors, and so we did offer our neighboring states the opportunities to utilize this lab, and so that offer still stands. We all work together in this.
What do you tell the Vice President today during your call?
I'm going to ask the Vice President, A, thank him for bringing the Surgeon General here to Connecticut, and B, we need a unified message, federal, state, and local. We can't send mixed messages out to people, and that's very important. You know, he's not the subject expert there, but he's convening those experts, and make sure that they continue to work with Renée and all the other labs around the country. And I just want to emphasize in closing what the Surgeon General said, which is vaccinations are safe and vaccinations work. Get your flu vaccination. It's not too late. We don't need you congesting the hospitals. It will keep you safer, keep the community safer, and free up capacity in our hospitals as needed. Thank you, everybody.
Thank you. Thank you. Great.